Hello, welcome back to Simply Women's Health with CJ. Today I'm coming to you from South Florida, where we are currently in the middle of a thunderstorm. So I figured what better time is there to discuss fibroids. You'll also hear them referred to as myomas or leiomyomas. If you stick around till the end of the video, I'll give you some suggestions for helping to manage your fibroid symptoms. Fibroids are growths that occur within the uterine muscle. Thankfully, the vast majority of them are non-cancerous. It's believed that anywhere from 40 to 80% of women have fibroids. There are people who are at increased risk. If you are African American, if you are obese, if you're between the ages of 30 and 40, if you've never had a baby before, or if you have a family history, that can all contribute to fibroid growth. We don't know what causes fibroids. We do know, however, that estrogen, a diet that is high in red meat, fat, dairy, alcohol, and caffeine can contribute to fibroid growth. Fibroids can be tiny. They can be smaller than a watermelon seed, or they can be as big as a grapefruit. Some people have no symptoms whatsoever. Some people have horrible symptoms. Those can include painful, heavy menstrual cycles, pain during intercourse, pelvic discomfort, back pain, bleeding in between periods. Unfortunately, fibroids can also increase your risk for infertility, miscarriage, as well as anemia. Fibroids are typically diagnosed on pelvic exam. They can also be seen on ultrasound, MRI, as well as hysteroscopy. So if you've been diagnosed with fibroids, what do you need to do? Honestly, it depends on your symptoms. If they are mild and you are close to menopause, you don't need to do anything at all. If you want to manage your fibroids naturally, that can be effective, especially if those fibroids are less than 4 centimeters in diameter. Things you can do: extra potassium in your diet. Think avocados, bananas, lean meat, fatty fish such as salmon, green leafy vegetables, whole grains such as quinoa, green tea. Vitamins A and D can also be effective. If you are having painful menstrual cycles, you can try using over-the-counter pain relievers as well as a heating pad. If your bleeding is heavy, hormonal birth control can help. You may also want to consider a hormonal IUD. If you wish to stay away from hormones, there are medications that can help with your clotting factors, such as tranexamic acid. There is another medication that is called Depo-Lupron. That medication can actually shrink your fibroids and it can stop your menstrual cycles. However, it does have some undesirable side effects, and it's recommended that you don't use Depo-Lupron for any more than 6 to 12 months. If you elect to have surgery, you can have that fibroid removed. That is called a myomectomy. Those are especially good for patients who desire future fertility. If you do not desire future fertility, there are some other procedures that are available: uterine artery embolization, uterine frequency ablation. The ultimate cure to all things fibroids is going to be the hysterectomy. I hope that you are writing down your questions in anticipation of your upcoming visit with your provider. In the meantime, if there's any questions that I can answer for you, please leave those in the comment section below. While you're in the comment section, if you want to go ahead and hit that like button, I sure would appreciate that.
If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from that information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.